So while we're waiting for our speakers to settle down, good afternoon, everyone. Magandang hapon in Filipino. I'm Renzo Ginto. I just finished my Doctor of Public Health at Harvard, and I'm literally en route now back to the Philippines to build PH Lab. PH stands for the Philippines, but also Planetary Health. We're not a chemistry lab that measures acids and bases. We are a global think and do tank that will innovate solutions that advance the health of both people and planet. So if you are a collaborator or an investor, join us, phlab.org. That's my lightning talk demo. And I will not repeat the instructions. We've done this twice. So just like the Filipino boxer Manny Pacquiao, when he gets into the boxing ring, let's get ready to rumble. Okay, so let's get started with VJ Limaya.
Hi, everybody. I'm Vijay. I'm with NRDC, the Natural Resources Defense Council. We're a nonprofit based in New York City. New York is going to be the focus of a lot of climate conversations later this month. And to date, a lot of that conversation has focused on the costs of transitioning our way of life and our whole planet towards a clean energy future. Largely sidelined from that discussion has been a full understanding of the costs that climate change is imposing on us right now, including profound human suffering and sometimes irreversible damage to human health around the world. In a sense, it's that human suffering and those costs that represent the climate tax that we're already paying right now. It's an unfair tax, one that is random from day to day and year to year. It's regressive and inflicted on those least able to pay it, and it's rising every single day that we kick the can down the road on this problem. There are reasons why health costs have been largely sidelined from the discussion, partly because it's challenging to estimate those costs. We don't have adequate tracking in this country and certainly globally in terms of the whole suite of climate-sensitive health impacts. And our policymakers often go to impacts that are easy to quantify, or the things that are insured, like property damage, infrastructure repair, or crop failure. So that's why I'm excited to share with you some new work that will be published in about 2 weeks in the AGU journal GeoHealth. It's our effort to shed light on the health costs of climate-sensitive events in the United States. So we looked at 1 year, 2012, across the country through a number of case studies to identify the toll of climate-sensitive events on human health and what that meant in terms of expenses. So here we're talking about loss of life, but also important illness burden to consider. And so when we think about climate-sensitive events, we're talking about the range of exposures that are expected to worsen in one way or another in the future. More frequent, more intense, longer, or over a wider areal extent. So what we did is look at state-specific case studies and connect health impacts to healthcare cost utilization data collected by the US federal government. So we're talking about the costs of loss of life, but also expensive medical care in this country associated with emergency room visits, hospitalizations, lost wages during those hospital visits, as well as prescribed medications and the need for outpatient care across the country. So it's the individual and societal toll in terms of expense associated with climate-sensitive events. As you can see here, we estimated $10 billion in health damages associated with just these case studies in 2012, when the country experienced some of its warmest weather to date, widespread wildfires in a number of states, Hurricane Sandy, an outbreak of West Nile virus, and more. So these impacts fell on individuals, and it's striking that almost 2/3 of the illness burden costs fell on Medicare and Medicaid patients. So just to take a step back, this work tells us that we need to include the health costs of climate change when we talk about mitigation and adaptation actions. We can avoid profound human suffering and expensive costs if we act now. We can't afford to do anything less. Thanks.
Thank you, VJ, just right on time. Now, William Deets, the microphone is yours.
So I'm Bill Deets, not Bill Dietz. And I'm the co-chair of this Lancet Commission on the Lancet Commission on Obesity, and we chose to focus on the three major pandemics that threaten the health of the planet and humans. These are obesity, undernutrition, and climate change. Obesity affects 2 billion people in the world and is accountable for about 4 million deaths per year and also accounts for about 3% of the GDP. Undernutrition also accounts for 2 billion people and 155 million children are undernourished and stunted. Undernutrition accounts for about 4 to 11% of the GDP, particularly in Asia and Africa. And climate change, you're familiar with, projected to account for 5 to 10% of the global GDP. We see the interaction of these three pandemics as what we call a syndemic, a synergy of pandemics. So climate change fosters undernutrition. Sam Myers has done a beautiful paper showing that climate change affects the nutrient value of foods produced and also contributes to food insecurity. Obesity and undernutrition are now occurring in the same children, particularly in low and middle income countries, to the tune of about 10% prevalence. And obesity interacts with climate change, both in terms of driving overconsumption, which is associated with overproduction and all the consequent contributions. Now, this syndemic is driven by systems with which you're familiar. These systems are food and agriculture, transport, land use, and urban design, and I think you can understand how easily these interact. So meat production generates methane, which causes climate change, which causes undernutrition. Transport contributes to inactivity, obesity, and the increased production of CO2, which contributes to climate change. But these are not the solutions. The solutions are here in these deeper drivers, which are social in nature. Now, the syndemic consists of the interaction of these three pandemics, which occur in the same time and place and are driven by social factors. These social factors are these underlying deep drivers, which have been discussed before in terms of growth, untrammeled growth, profit at any cost, which are a consequence of weak governance, policy resistance, and particularly policy inertia. Policy resistance caused by large industries. Now, these are also filtered through power of social determinants, environments, and populations. The promise of this perspective is that it offers us the possibility of 2- and 3-fold actions to simultaneously affect 2 or all 3 of these pandemics. And those of you who are staying for the NCD panel will hear more about those solutions.
Thank you very much. Thank you, William. And now, Sarah Nelson, come on in.
Hi, I'm Sarah Nelson. I'm from the University of Sydney. I'm a PhD student on the WISH program. Today I'm going to talk to you. When I first mentioned the word Fiji, I'm sure everyone thinks of the picture-perfect island tropical paradise, as you can see in the bottom picture. Issues with water is probably not what people think about, especially on these beautiful islands surrounded by water. Unfortunately, access to water is a critical issue within the region, which is being influenced by rising sea levels and climate change. One of the great difficulties is that water does not typically flow to political and administration boundaries. Instead, it flows to ecological and geographical determinants. We in the health field think in administrative boundaries. Water requires us to think differently. In this short talk, I introduced the idea of water catchments, also known as watersheds, as an idea of epidemiological analysis and intervention. This is a relatively novel idea, and human health and water catchment management is really mentioned in the literature together. As you can see, based on this image, the top right-hand side shows the theory of the catchment where the water flows down into a basin, and the bottom picture is what the catchment looks like in theory. So catchments are an important source to study transdisciplinary research as they link agriculture development, population growth, and climate change. Human health is highly reliant on the natural state of these sorts of ecosystems, so this highly links into the transdisciplinary approach and to the planetary health ethos. The limited literature does show that water catchment coverage does impact human health. One study specifically showed higher upstream coverage with trees caused lower rates of diarrheal disease in children. So specifically, Fiji was chosen for our project as this island nation is heavily burdened by water-related outbreaks, and these outbreaks are heavily influenced by hygiene, sanitation, land use, ecological degradation, and climate change. In our project, we are going to be using water catchments as a unit of epidemiological analysis and intervention. Our aim is to assess water catchments and health systems intervention across 30 communities within 3 divisions within Fiji, with the idea that we'll be looking at different catchments have different needs. Some have high rates of leptospirosis, some have dengue fever. So we'll be addressing typhoid, lepto, and dengue with the aim to try and create individual targeted interventions for these communities to adapt to working with the communities. So the aim of this work is to continue to hold the long-held idea of Fiji as a paradise. Thank you.
Thank you very much, Sarah. And now it's Manu Prakash's turn.
I'll start with a quiz, and that's not my slide. Okay, who knows what that little ball of metal is to the right? Sputnik. So that also speaks for the age of some of the audience. Some of the younger ones might not have actually seen that object. But the time it was launched, we had no technology to actually track that object in space. That caused panic, a lot of that in the US. And a famous astronomer actually started what is called Operation Moonwatch, which was the world's largest citizen science and the oldest running citizen science program even till today, to track that object. Nobody in any military or we had all the money you could throw at it as a problem. And the first time Sputnik was spotted was by one of these amateur astronomers who was provided a telescope that was shipped by the Smithsonian. And one of the contexts that, the reason I bring this as a story is, we all know the doom and gloom and thinking really about the fact that there is an incredible number of problems that are deeply connected. Ironically, many of our measurement tools happen to be satellites, but they're not enough. We need planetary scale measurement tools, and of course it's a large planet. More so, what we need if we're going to actually have these sets of measurements of dramatically changing things on the planet, to make an impact, we need to include the people who live on this planet to be part of that measurement machinery. And one of the big things that we've been thinking about over the last couple of years has been a theme that I call frugal science. My name is Manu. I'm a faculty at Stanford. With the idea of providing the largest possible scale that we can of measurement tools to individuals that you might consider to be ordinary, but are primarily living the sets of challenges that we're all talking about. And we all have this privilege to be curious and thinking about these sets of problems, but many of these people actually have never even had the privilege to be curious about these problems. For very specific tool, how many of you know or have used a foldscope? So that's 20% of the room. Anybody who wants to know about it, I have a few you can play with. This is an instrument that we built that cost around $1 and allows you to do microscopy at 700 nanometer resolution. But one of the big things that we thought about is how do we share a tool like that? And although we were making tools, we ended up realizing it's the community that we were building. At this point, there is 1 million of these tools that are out there in hands of kids around the world. And it's one of the world's largest amateur microscopy community, and also probably one of the largest scientific organizations. Even if I look at something like the American Society of Microbiology, doesn't have 1 million participants. And we don't dictate what these community members do. They do incredible things all the way. These are pictures from rural Tamil Nadu, agricultural. This is actually a picture from Kirkuk, Iraq, which was under ISIS control a couple of years ago. These are Chilean fishing workers looking at planktonic ecosystems, South Africa. There used to be a president that actually knew something about microscopy. And if you care about these sets of tools, you can check much of the work and publications. There is a large number of tools. And then if you want to actually use one, come find me at the end of the day. Thanks.
Thanks, Manu, for reminding us about the importance of citizens in science. And now let's call on Eleanor Eaton.
Hello. We have a language problem. If we want to make genuine progress on health in our planet's cities, we need to address a language barrier between the language of academics and policymakers. Imagine you're a city planner or an urban developer who wants to make a new neighbourhood as healthy as possible. You only have a limited amount of resources, and you need to make a business case which shows your interventions represent the best possible outcome from your new residents. You'll find the problem isn't a lack of evidence at all, but how this evidence is translated and interpreted and how you're going to use that. One practitioner told us it's really difficult to get the link between academic research and what's actually read by people in the private sector. There doesn't seem to be a body to be able to package it up and get it to us in bite-sized form. We're offering a solution to this. Using a systematic review of the medical evidence, we define 26 characteristics of the built urban environment which have an impact on health. What's more, we value changes in each one of these so that we can compare the relative weight of each outcome. Just taking one, walkability, as an example, we brought several studies together to calculate the impact which a change in provision in this item can have on health outcomes such as activity, diabetes, weight gain, and mental health in a standard population. Using our approach, you can compare adding ventilation to 500 homes to putting a park nearby and see which one is the most effective in terms of averted health costs. Or to see that just by reducing noise levels in homes for 1,000 people could save an average of $870 per person per year by affecting not just mortality of your residents, but the mental health of the children that live there. This study was for a project called Upstream. We wanted to investigate how to move health further upstream in the decision-making process, away from spending decisions by healthcare providers, towards those decisions about living conditions that determine health. We interviewed senior policymakers about the complex systemic barriers which prevent the creation of our healthy cities, and the message was clear from both public and private sector that health is not adequately accounted for or resourced in urban planning. As academics and policymakers, we need to show the societal benefit of investing in health. By packaging up the data and using metrics which everybody understands for the cost of illness, which are easily understood, we hope that at least in the new build sector and beyond, we can start speaking the same language. It's urban-health-upstream. Come and see us online and see our reports. Thank you.
Thank you very much, Eleanor. Indeed, we must think and move upstream. And now, last but not the least, Catherine Kreis.
If you don't mind, I'd prefer to, yeah, it's working, great. I'm Catherine Kreis. I'm the Director of Strategic Initiatives and the lead for Nutrition Innovation at PATH. And I run sort of an incubator there on new ideas on how to improve nutrition. And one of the things that we've been thinking about quite a bit is that climate is really having a large effect on food systems, and we need to really start to think about how we work with the environmental sector. And so just a couple of years ago, we took the time to get together with the Nature Conservancy, Duke University, and the International Food Policy Research Institute to form a new collaborative called the Bridge Collaborative, which is really focused on doing field-based, field-oriented, practical solutions that can actually have the potential to go to scale. So a little bit more downstream than the research piece, but really trying to engage across sectors to both improve the outcomes that we have, to do them more quickly, to do them better, and to think about upfront negative externalities across sectors that we could mitigate or prevent by doing a little bit of cross-sector thinking up front. And so from that effort, we have gotten a little bit of funding. And so what I want to talk to you about today is everybody's favorite topic, and that's funding for your great ideas that's going to be available. So I had a slide with the information on it, but could you? Yeah, that's the one, great. So we're announcing the Bridge Collaborative Spark Fund. And that's going to be a grant or 4 grants that are going to be available for up to $150,000 to sort of advance testing of solutions that benefit people and nature in 3 broad areas. One is accelerating a low-carbon, clean air, and environmentally friendly energy future for all. The second area is around transforming the global food system for health and sustainability. And the third is improving sanitation and wastewater management to benefit people and nature. Who can apply? Pretty much everyone in this room is probably eligible. Not-for-profit organizations, institutions of higher education, not-for-profit and public, government agencies, all of you are welcome to apply. We're accepting pre-proposals by October 4th. It's a pretty low lift. And you're certainly welcome to join together with other groups and think through those sorts of projects that are, that are pragmatic and sort of at the point where you would potentially want to advance multiple impacts for development, health, and the environment from a very practical perspective on the ground. 2 of those grants will go domestically. 2 of those grants will go outside of the United States. And in terms of what we'll be looking for, we'll be looking at kind of the strength of the evidence, the potential for global impact, mechanisms for scaling and implementation. And certainly, we welcome all of you. I've put this little thing up here. You could just use your cell phone, take a picture of that. Go to www.bridgecollaborative.global.org. There's a link right there where you can apply and find out more information, or come talk to me. I always tell people my crowning joy is that my name rhymes with the organization I work with, so it's Kath from Path, very easy to remember, and I'm happy to talk to any of you. Thank you so much.
Hello. Thank you very much, Catherine, and thank you to your amazing ideas. The seeds have now been planted. It's now our turn to grow them into fruition. Go forth and multiply. Thank you.
Thank you so much, everyone.